All right, guys, we got Dr. Eric Niemeyer here with us. He specializes in family medicine down in Hyde Park and lives locally right around the corner. Dr. Niemeyer graduated med school from UC, and he also sits on the board with Matthew 25. I know we've all heard of that and all the great things that they do. He's a good buddy of mine, and he's also a patient of the practice. I got a lot of respect for Dr. Niemeyer. So thanks for coming on. Thanks for taking a couple minutes. I know you're busy.
Sure. Thank you. No problem.
Couple quick questions, man. You're on the front lines day in and day out, kind of in these clinics trying to help people, keep people safe. And before we forget, thanks for doing that, man. That's a huge sacrifice because Dr. Niemeyer's got a family, a couple of kids at home. So, we owe him a big debt of gratitude. But, what advice are you giving to your patients right now to stay physically healthy, to stay mentally healthy through all this?
Yeah. So, first of all, we get this question a ton, and I've said this a lot to my patients. I've said, we're all kind of staying at home. I think we can go a little stir crazy. I think we're lucky the weather's getting nicer, still obeying the social distancing rules, but, getting outside, if you've got kids, they need to be outside. From an exercise perspective, make sure we're still doing the same things. It's a little more limited. You can't go to the gym, but, go for a walk, go for a run. Do that kind of stuff. Make sure you're getting a good night's sleep. There's a lot of looking at the outcomes for people that if they're not getting enough sleep, the outcomes are worse. So making sure we're getting good rest and just keeping yourself as healthy as possible. The same general rules we would follow basically all the time with the context now of we pretty much just think of it like you can't leave your house and make sure we can get outside a little bit and just stay active both physically and mentally.
Yeah, that's good to know. It could be easy to just be drawn into the TV and just sit there on the couch, but it sounds like that's the worst thing we could do.
Yeah, I think, during the day, you want to stay as active as you can. If you've got kids, get them outside. If you don't, just get outside yourself. Even if it's sitting in your driveway reading a book when it's nice and the sun's out is a good idea. You can get sucked into the wormhole of watching the TV and watching all of the different people giving their talks every day. And some of that information I think is good to stay aware of. But you could sit there all day and get differing opinions. I think, again, reading books, reading magazines, something just to keep your mind busy, keep your mind active. If you like doing puzzles, if you like doing, crossword puzzles, anything like that, just the things that we normally would be doing 8 to 5 during the day, during work, staying busy, mentally, we got to try to do a little bit of that during this time as well.
That's good advice. Another common question we're running into, and everybody's thinking it, if something's wrong, if you're not feeling good, when do you call your doctor? When should you go to the ER? When should you call 911? What kind of guidelines could you recommend?
So yeah, I think there's different levels. I think this is a bad time of year for a lot of people because Ohio and particularly Cincinnati being a bad place to live for allergies. We're seeing a lot of people with sinus symptoms and allergy symptoms that if you took the coronavirus COVID-19 out of the situation, nobody would think two things of it. They would say, okay, I've got some allergies, runny nose, cough. So I think consistently the people who've run into trouble with the coronavirus have all had, really high fevers, body aches, and dyspnea with exertion or shortness of breath, which is just described as feeling really short of breath with moving around. So I think those are sort of the take-home points for people that would be what I would consider an urgent level, which means you need to be seen by somebody. Now, I would have a quicker trigger for somebody to be seen if you're over 65, if you've got other medical conditions, heart disease, diabetes, COPD, asthma, severe things like that. We may want you seen a little sooner. If you're a young, healthy person, then if you develop those things, I would start off either way with calling your doctor and get advice from them on what they think. That's more important now than ever because we don't want to flood the ER with people who there's nothing to do for. We are only testing high-risk patients right now, and there are limited facilities around the area that are doing that testing. So if you've got mild symptoms, the odds are your doctor is going to tell you, stay at home, rest, hydrate, take Tylenol. But for those people over 65, cardiovascular conditions, diabetes, we may want you to call a little bit quicker, maybe even if it's just a fever and otherwise there's not many other symptoms.
Okay. That's good to know, Doc. I appreciate your time. I know you're busy. I know you got a lot going on, but just stay safe, man. And everyone else stay home, all right?
Yes, I would agree with that. The more we can stay home right now and everybody be safe and kind of keep to yourselves and, you know, wave to your neighbors and say hi across the yard. The more we can do that right now, the shorter period of time we'll have to do it. And the quicker we'll be able to get back to normal life.
Good. Back to Reds baseball soon.
I hope so.
All right, Doc, stay healthy, man.
Thank you. Appreciate it.